Hello, my name is Dr. Dewan S. Raja. Today I will discuss about hemophilia. What is hemophilia? Hemophilia is a bleeding disorder that affects the blood's ability to clot. It is caused by a deficiency or dysfunction of blood clotting factors like factor 8, that is called classic hemophilia or hemophilia A, or it may be due to deficiency of factor 9, that is called hemophilia B or Christmas disease. This name Christmas is from a patient, not from a holiday, which can lead to prolonged bleeding. So both the type A, that is classic hemophilia A, or hemophilia B, both may cause prolonged bleeding. Genetic inheritance hemophilia is typically an inherited disorder, but it can happen spontaneously by mutation in around 30% cases. So it may not be inherited. Okay, it may be due to spontaneous mutation in around 30% cases, we must remember. But it is typically an inherited disorder, X-linked recessive, and is passed down from parents to their children through a faulty gene located on the X chromosome. It primarily affects male as they have only one X chromosome. Females are usually carriers, but female may also suffer if they have both the X chromosomes defective or they have lost one X chromosome by leuanization or due to the chromosomal disorder like that of Turner syndrome. In that condition, female may also suffer from hemophilia. Female are usually carriers and men are the sufferers, with a 50% chance of passing the gene to their offspring. Okay, so if we look at this image from CDC, X chromosome inheritance, mother who is heterozygous, a carrier, father without hemophilia, what happened? A son will have hemophilia. The daughter, one of the daughter will be carrier and another daughter is free from hemophilia. Another son is without hemophilia. So 25% chance, and 25% chance out of these 4 children, 25% chance for a daughter to be a carrier, 25% chance for a son to be a hemophilic patient. This is an X-linked recessive disorder. Here again, father with hemophilia, mother with no hemophilia, what happened? 50% chance daughter who is heterozygous, carrier, son is without hemophilia. Okay, 50% chance son without hemophilia. So this is a X-linked recessive disorder. Okay, here symptoms. Common symptoms include prolonged bleeding from cuts, joint like that of the knee joint, ankle joint, elbow joint, and muscle bleeding. There may be easy bruising, and in severe cases, spontaneous gastrointestinal hemorrhage. Okay, bleeding, joint bleeding can lead to long-term joint damage. Compartment syndrome can occur from large hematoma that may compress the nerve and blood vessel. Hematuria, that is bleeding along with urine, may be present. How to diagnose the hemophilia? Hemophilia is diagnosed through blood test that measures the level of clotting factor in the blood. PTT is prolonged, but PT is normal. That is true for both classic hemophilia as well as hemophilia B or the Christmas disease. Reduced factor 8 or 9, that may happen. If it is classic, then factor 8 will be reduced. It may be factor 9 in case of Christmas disease or hemophilia B disease. Genetic testing can also confirm the presence of defective gene. Okay, so we got the diagnosis symptom. What is the differential diagnosis? Any other bleeding disorder, like that of the problem in the platelets, or maybe like that of the von Willebrand disease. Okay, we got that. So treatment, hemophilia is typically managed through replacement therapy, where the missing clotting factor like factor 8 or maybe factor 9. Factor 8 deficiency is more common. Around 75% of the hemophilic patients are classic hemophilia A. Only the 25% is that of the Christmas or hemophilia B disease. Okay. So, and also we have just discussed that it may not be inherited. It may be spontaneous mutation around 1/3, around 30% of the hemophilic patient. Okay. So we have problem in the clotting factor. We'll replace the patient with the clotting factor. That is the treatment. This can be done preventively or on demand depending on the severity of the condition. Factor concentrate, clotting factor concentrate used in the treatment have evolved, and some are now produced through recombinant DNA technology. Little bit costlier, may not be affordable by the countries with economic disadvantage. This reduces the risk of infection. This recombinant product that are associated with earlier blood-derived clotting factor concentrate in the previous treatment, that is from blood-derived clotting factor, there was chance of HIV infection. Now it can be overcome that problem. We may give the recombinant DNA technology derived clotting factors that will not cause any type of infection. Prophylactic treatment, some individuals with severe hemophilia receive regular prophylactic infusion of clotting factor like factor 8 and factor 9, or maybe just factor 8 depending on the situation. If it is just the classic hemophilia, then we only give factor 8 to reduce the risk of spontaneous bleeding or long-term joint damage. Okay, we need prophylactic treatment. Bleeding Disorder Center, comprehensive care for children with hemophilia are often provided by specialized hemophilia treatment center. Patients should be encouraged to meet with them, where a multidisciplinary team containing the internal medicine physician, hematologist, and also the orthopedic surgeon, they may work together. Okay, can address the various aspects of the condition. Lifestyle consideration, people with hemophilia need to take precaution to avoid injuries like body contact sports that could lead to bleeding. They may also need to adjust their lifestyle to minimize the risk of bleeding episode, avoidance of aspirin and other NSAIDs. Research and advances. Ongoing research continues to explore new treatment, gene therapies and technologies aimed at improving the quality of life for individuals with hemophilia. Okay, so hopefully one day we'll get the gene therapy. Okay, so that's all about the hemophilia. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. And always share the information with your friends. Have a nice, wonderful, and blessed day. Bye now.